N95 masks. And this is basically the Tesla of the masks. They're in more short supply. One thing might be short, the other thing might be enough, and you're kind of in the seesaw effect. So the more hospitalized patients you have with COVID, the more you need equipment. And I'd say there's so many different components of PPE. Oftentimes one is short, the other is not short. So a lot of times trained professionals have to spend a lot of energy and effort doing things that we're not supposed to do. I mean, we're supposed to be taking care of patients, not sort of filling out inventories for how many different levels of supply we have. The surge, of course, impacts the supply of PPE a lot because you need a lot more in the hospital. It definitely affects need. It definitely jeopardizes the supply stock that we have. So I think different places are doing different things. What's needed is what was needed all along from day zero, which is a strong central voice and a strong advocate for getting supplies from suppliers. The lines of distribution in the US, they're not quite as nimble as we like. They're not necessarily responsive to real-time need. Divert some of our factories or supply lines to making some of the supplies ourselves. There was talk from the beginning that 3M would do millions of masks, but actually haven't seen any of those outcomes yet on the ground level. You know, the virus doesn't know have any political affiliation. The virus doesn't care if you're a red state or blue state. And I think making some of these supplies a political issue has really done a disservice to public health and to protection of the people of the United States.